nurses in communicable diseases. And they're running around like chickens with their heads cut off, trying to meet all of the prioritized needs. So the health officer said, okay, people in skilled nursing facilities take priority in terms of testing, and then any other healthcare workers and other health facilities take priority testing. And so only four nurses have to go out and personally investigate all these places, all these facilities, and administer the test. And then they have to do the contact tracing, which she said is the most difficult, because you're tracking down numbers and you have to do interviews with everybody. She said it's just too much.
Yeah.
They're clearly not providing the support, and that's happening obviously where you are too.
Right.
Yeah.
Yeah, and so with this gentleman that is pretty sure, like his symptoms are pretty sure of COVID, they're not saying why they're denying his testing, or they're refusing the.
It's an online algorithm that overrides the doctor's order.
Were you ever able to get that conference call with the doctor to them?
We did. Oh, I didn't realize I had told you about this.
Yeah.
Yes, and that's where we found out that because we called the public health department, we're like, this is outrageous. You know, he has a doctor's order, but the doctor doesn't do the tests in his office, and he hasn't been able to get the PPE for his office, so he's not even comfortable with having patients come in right now.
Wow.
He's doing phone consultations and everything because he can't provide enough PPE for both his staff and patients.
Right.
And nobody can get it right now, you know? So he wrote the order for his patient, and the patient came based off of the symptoms he's exhibiting, right?
Right.
And but he doesn't administer the tests himself because he doesn't have the equipment.
Right.
So that means that you have to find a place that's giving the test, right? And so we called the public health department with the doctor on the phone, and this is basically they keep the nurses and other support staff there totally in the dark. Like, the nurse didn't even know what the Project Baseline online survey had to say.
Wow.
She's like, well, she said, well, is he exhibiting symptoms? And the doctor said, yeah, but not any of the things that you ask on your online survey.
Right.
And the symptoms are so varied. And she's like, well, is he running a fever? And we said, well, he feels feverish, but he lives alone. He's 63 years old, and he doesn't have a thermometer in his house.
Mm-hmm.
And we said, can't you as the public health department go test this person? You know, like, you're a nurse, you're a public health nurse. Like, can you go to his place and test him? And she's like, yeah, we don't do that, and here's our order of priority.
Oh, wow.
Yeah. And so, I mean, she's like totally overwhelmed. Like, she's not, she agrees with us, but she didn't even know what the online survey said herself. And we're like, well, you should check it out because, you should know what it says.
Right.
Because it clearly is not designed to provide a vast number of people testing.
Right.
And when we started calling around, because we found 2 urgent cares that'll give the testing, when we started calling around, we got one of the urgent care clinics sends you to a call center, because we called over the weekend, so that's their what do you call it? Off-duty doctor service.
Oh, yeah.
It goes to some call center somewhere.
Right.
And where it went to was somewhere in the South, like in Georgia.
Mm-hmm.
And so our volunteer here, who was doing the advocacy, started asking questions of the woman who answered, who was a nurse. And she said, well, here in Georgia, we have like drive-through testing everywhere. She's like, you go to CVS and get a test right out of your window.
Oh, wow.
Yeah, I was like, what is the problem with California? Like, how can we not roll these out?
Right.
What is the problem? And I know they're saying, well, there's false negatives, there's false. Okay, but let's get the ball rolling here.
Yeah, you have to start somewhere.
You have to have some basis to start with.
Right.
God, it's so, and there's no consistent anything throughout the state, throughout the country. And I think that really, that points to a much bigger problem that is not medical. It's definitely
Right.
with leadership. It's with the government itself.
Right.
You know, proving itself to be wholly incapable of meeting the needs of the people, and just, you know, it's like they're waiting to see what move they're going to make based off of what contracts can be made with whom and who can cut the best deal.
Right. I totally
You
agree.
know?
Yeah. Yeah, I
So
totally agree.
so we're chipping away at this. I have a letter that I want to send your way. I think you would agree with it. Did I tell you that we produce a letter that supporters and others are signing and sending to their board of supervisors, or to the board of supervisors in the county and to the health officer. And it's you can, you know, take a look over, and I'll send you a physical copy so that you can sign it and date it and send it in if you agree with it.
Yeah, for sure.
Yeah, and it's, you know, part of it is saying, hey, look, we have to move beyond right here and now with COVID. I was just reading something in the news this morning. These doctors from UC Davis Med Center are like, you know, we need to get a very important message out here right now, which is healthcare delayed is healthcare denied.
Right.
And if people are not going to the hospital because they're afraid or they're getting the impression or they're advised to stay away, then what's happening is people who have other illnesses are coming in at a point in which we can't treat them. And they cited a case of a woman who has a chronic heart problem but was advised to stay away from the hospital. And so she came in at a point at which they could not save her.
Oh, wow.
And she didn't have COVID-19, right? They said they've had 4 stroke patients in the last week that I might be misremembering the details now, but it was 4 stroke patients that basically did not, you know, had worse outcomes because they had delayed going to the hospital.
Wow.
And they had said that they had never seen an instance where stroke patients would delay going to the ER. And, you know, that has serious repercussions on the outcome.
Oh, yeah. I mean, they're putting it out there to where it's saying that the hospitals are overfilled, you know, the emergency rooms are overfilled, not to go. So that's what they're putting out there, and people are not wanting to go, thinking that it's true, and it's not.
Well, I know one instance in which somebody was actually told that, so this man who had been in like acute recovery facility, had been released back to home, but he was home alone, and he has multiple complications. Probably the most severe is diabetes, and he was not feeling well, and he called the hospital, and they tried every which way to tell him he should not come in. And finally he got a hold of a friend who said this is ridiculous and loaded him up and took him down to the ER. And as a result, they amputated his leg, and then he died 2 days later.
Oh, wow.
And that was because the hospital kept telling him, no, don't come down, don't come down. Isn't that sick?
Yes, very.
It's so unacceptable. These are the real cases that are impacting people. Oh, so anyhow, I will send you that letter, and I hope that you can help us get it out to others. You let me know once you read it if you want more copies or if you want to make a copy and give it out.
Okay, for sure.
You know, to your coworkers.
Oh, yeah, for sure.
So it sounds like you said you have to work